It's been a very interesting year, this past one, and a challenging one for McCord Hospital and our staff and our patients too, and we'd like to share a little bit of that journey with you. We've passed some major milestones in the hospital with respect to the financial problems and overcoming them. We've faced another big issue around the accreditation process, which is nicely in hand and has reaped some significant benefits for the staff and the patients and the hospital. And we've had a major challenge as well with respect to balancing this need of the caring for the public sector type of patient and the patient that has come from the public sector who demands a little bit more, as well as those that are coming from the private sector whose medical aids have run out, who also expect a bit more. The balancing act is an interesting one, it's a challenging one, and it's a difficult one, and I commend our staff and particularly our board, who have been so supportive in helping us come through these dilemmas, these challenges. And I'd invite you now to take part in seeing a little bit about what we have done within the hospital and then also in our community outreach work. But above all, I would like to give thanks and praise to the Lord for the way in which He has blessed and guided and directed us in this year and in the years past, and we look forward to the challenges and the developments in the future under His guidance and under His direction.
In 1998, government funding in the health sector was significantly cut. Durban's McCord Hospital was presented with a unique challenge: how to continue to be true to their stated vision of serving the underserved in the spirit of Jesus Christ, whilst continuing to be financially viable. On the 8th of August 1999, the 90th anniversary of McCord's was more than a mere birthday. It was a celebration of a challenge accepted and surpassed.
People are happy and others are dancing, but there's something I want to ask you. Don't you think that people must not forget what is this day for?
Yes, they mustn't forget that this day is for raising funds for children with AIDS, and I also have a message for you.
Min mense is bewus daarvan dat een van Durban se oudste hospitale, die McCord Hospital, midde in die besige Overport geleë is.
Dr. J. Manny, Deputy Superintendent of the hospital, was interviewed on South African television on the occasion of the 90th birthday.
Now, the hospital is taking in a new direction. You're a private and public hospital. What is the distinction there?
We're still a mission hospital. In other words, what Dr. McCord initially started as a service to the community according to the example of Jesus Christ is still something we dearly hold to and will continue to hold to. But then in order for the hospital to survive, one has to use different means, and this is one of the means we've used. But bringing in money through a type of private sector stance that we've taken helps us still to have the public outreach that we have. Example, the clinic that we have at Adams Mission. Training of community health workers, training of primary health care nurses still continues as a part of McCord's vision. And so we are able to take what we get through private and use still in a non-private sense.
So it's a new concept. It's the only hospital that's taking this route.
Yeah, to my knowledge, it's probably the only hospital in the province which has got this public-private sector interface. We opened 2 semi-private wards on the 8th of December 1998. These wards cater now for a semi-private patient at a cost of about 400 rand per night, which then includes your doctor, your drugs, your drip, whatever else that comes with treatment, which unlike in a private hospital per se, you probably pay 500 rand per night just for your bed. We're at the moment providing probably again in very few hospitals laparoscopic surgery, which is, and you have consultants from King Edward Hospital that come across to McCord to learn from our Dr. Quinlan, who's our gynecologist. And he's teaching laparoscopic surgery, and there's probably two lists a week, and really full-up lists, which is very modern surgery, which McCord's 2 years ago never dreamt that we would come to that stage. And many visitors actually are quite surprised by what we've now achieved. Now at the count of 3, we'll ask Mrs. Baloy to officially open the McCord Medical Center. You can count with me. 1, 2, 3.
Constructive financial management has meant that in addition to the privatization process, medical services to McCord's traditional patients have continued, with significant numbers of new patients each week. This has been much facilitated by a focused and people-oriented advertising campaign using the broad spectrum of available media. The last year has seen several ambitious community outreach programs, ranging from highly popular baby competitions to major fundraising ventures enjoying national TV coverage.
What we're seeing here is a lot of excitement and enthusiasm and beautiful babies and excited mothers and a desire of the hospital to be part of a much bigger service.
We've come to the end of this week where we have remembered those who are suffering from AIDS or HIV.
At the end of most success stories lie formalities and speeches. This last week saw the return home of 2 young Durban cyclists after an epic round-the-world tour to raise awareness and money for the AIDS cause in KwaZulu-Natal. In the last year, Steve Bonaconsa and Travis Gale have ridden 16,000 kilometers across 5 continents to give hope to AIDS sufferers back home. With little or no backup, these 2 lads relied on the goodwill of church groups and people they met on the road for support and accommodation. For them, this was no Sunday school picnic. They braved the commuters of Europe and celebrated with the children of Africa. This story had a happy ending in Durban on Christmas Eve, as they were personally able to tell the mayor, Councillor Nomsa Dube, of their success in reaching their target of raising 1 million rand for an HIV/AIDS support centre at Durban's McCord Hospital and the Lily of the Valley Village for HIV orphans.
Wow, that's wonderful. That's great. Wow.
President Thabo Mbeki was personally represented by the Minister for Health, Dr. Manto Shabalala Msimang.
During the festive season, we often look into ourselves to rediscover the human kindness we sometimes seem to misplace throughout the year. I think it is thus very appropriate that we use this opportunity today to pay tribute to the 2 men, Stephen and Travis, that remind us what it means to reach out to our fellow South Africans.
Good stories have happy endings, and money raised from the Cycle the World tour has already made a difference to these young lives. In this time when our country faces the onslaught of HIV/AIDS and debate still rages about appropriate measures, McCord Hospital has stood up and taken responsibility for the people she serves. The Sinigitemba support program for people living with AIDS brings empowerment and dignity to the lives of more and more precious South Africans each day.
6 months ago, I lost my baby. It was 6 months. And the baby was infected. I lost the baby because the baby was infected with AIDS. So my life changed. My life changed upside down. It was bad. And I don't know what to do, who to talk to. my life was upside down, and I go to someone and talk to him, counseling me, and tell me about the McCord. Down McCord Hospital, there is a center down there who can help me. And at McCord, they taught me that I can help myself by doing something that can give me money, because I'm a mother of 2. Now, I accept everything that I am. It's okay. I know that I am positive, but I know that I can live with it. I can do something. I can help other people, and people can help us by encouraging us. They can open out for us. This can give us hope.
I think all credit goes to the Lord Jesus Christ for the direction that He's given us. And being a mission hospital based, the foundation, and if you can see the cross from many miles away from the hospital, especially at night, the foundation of our hospital is the Lord Jesus Christ. And we feel that whatever the direction that He is leading us, He will take us. The work that He started, He will take to completion.